In 1992, the Department of Labor instituted the Blood-Borne Pathogen Standards in order to protect employees from diseases transmitted through blood.
The standard, which is effective as of March 6, 1992, is a pioneering step by the Department of Labor to protect all of us from blood-borne pathogens.
This training is required annually. Blood-borne pathogens, BBPs, are infectious microorganisms present in blood that can cause disease in humans. The two that present the greatest risk are the viruses human immunodeficiency virus, HIV, and hepatitis B virus, HBV. Other contagions include hepatitis C, malaria, syphilis, and more. 4 conditions must exist for a BBP to be transferred between people. A pathogen is present. One person is infected with a BBP. There is enough of the pathogen to cause a disease. A route of transmission. There must be a way for the infected blood of one person to get into another's bloodstream. A person is susceptible to the virus. Transmission of pathogens in the work environment is most likely to occur through broken skin, including rashes or abrasions, mucous membranes of your eyes, mouth, and nose, and most commonly by contaminated sharp objects or needles. The Center for Disease Control, CDC, estimates that more than 1 million people in the U.S. are living with HIV infection, of which 1 in 5, or 20%, is unaware of their infection. The incubation period from HIV infection to AIDS could be over 10 years. HIV symptoms vary, but often include weakness, fever, sore throat, nausea, headaches, diarrhea, swollen lymph glands, weight loss. Post-exposure testing for HIV should be completed within 72 hours and then periodically for up to 6 months. The HIV virus cannot survive outside the body for very long. The HBV and hepatitis C, HCV viruses, however, can live outside the body for days. HBV and HCV both attack the liver. HBV can lead to serious conditions such as cirrhosis and liver cancer. Many people with HCV and HBV have no symptoms, or they may be very mild and flu-like: loss of appetite, nausea, fatigue, muscle or joint aches, mild fever, headache, and/or possibly jaundice. The only way to know if you are currently infected with HBV or HCV, or if you still carry the virus, is to ask your doctor to do a specific blood test. There is no cure or specific treatment for HBV, but there is a vaccine to prevent HBV. There is no vaccine for HCV. Employees who have routine exposure to BBPs, even part-time and temporary employees, must be offered the hepatitis B vaccine series at no cost to themselves unless they previously received the vaccine series, antibody testing has revealed immunity, the vaccine is contraindicated for some medical reason, such as an allergy to yeast, which is in the vaccine. The vaccination is given in a series of 3 shots. The second shot is given 1 month after the first. The third shot follows 5 months after the second. The series must be offered at no cost to the employee during work hours and within 10 days of an assignment to a potential exposure to BBPs. Employees may opt to decline the vaccine, but they must complete a declination form. Employers must keep these forms on file so that they know the vaccination status of everyone who has a potential exposure to blood. The employee has the right to change their mind at any time and take the vaccine. HBV vaccine side effects are mild. The most common symptoms are bruising, redness, headache, localized swelling and pain at the injection site. Severe side effects include allergic reactions. If this occurs, seek medical help. OSHA tries to minimize employees' risk of exposure to BBPs by requiring programs at facilities that include universal precautions, personal protective equipment, PPE, engineering controls, workplace practice controls, and administrative controls. Your employer is responsible for the cost of implementing these practices, and as the employee, you must conform to the policies. Universal precautions are designed to prevent transmission of blood-borne pathogens. Anything that is used to protect a person from exposure is a universal precaution. The first rule is to assume that all blood and other potentially infectious materials, OPIM, are infectious. If it's wet, don't touch it. OPIMs include any body fluid containing visible blood, semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, amniotic fluid, and infected cultures. PPE, personal protective equipment, is used to provide a barrier between you and potential infections. Remember to protect yourself when the possibility of exposure to blood or infectious materials exists. Use a BBP kit. It will contain aprons or jumpsuits, gloves, masks, and cleanup supplies, eye shields, caps, booties, and pocket masks. All PPE must be removed before leaving the work area. Engineering controls are physical devices used to eliminate hazards at their source. Some engineering controls include hand and eye washing stations, biohazard labels, or self-sheathing needles. These controls must be easily accessible and near the point of care. Regular inspection and maintenance of engineering controls are mandatory. Work practice controls are designed to influence the actions of employees to reduce the likelihood of exposure. Some examples would be policies on hand washing, regulated waste, and recapping needles. PPE engineering controls and workplace practice controls should be used in unison to limit exposure to BBPs. Your employer must make PPE available at no cost and in all sizes to the employees. Employees must use PPE. Gloves should be disposable and replaced as soon as they are torn or punctured and made of fluid impervious material. Inspect gloves before use. If you have cuts or sores on your hands, you should cover these with a bandage as an additional precaution. Double gloving can provide an additional layer of protection. When removing the first glove, your hand is protected because both are covered with the glove. Grab the outside of the infected glove and remove. To remove the second glove, your other hand is no longer protected, so carefully slide one finger inside the glove where there is protection and remove the glove by inverting it upon itself. Change gloves and wash your hands if dealing with more than one victim. Never rub the eyes, mouth, or face while wearing gloves. Dispose of gloves as well as other PPE clothing in biohazard disposal bags. Wash your hands after glove removal, an exposure incident, or cleaning of BBP areas. Hand washing is one of the most important and easiest practices used to prevent transmission of blood and airborne. Use antibacterial soap. Wash your hands for at least 20 seconds, which equals singing Happy Birthday twice. Hand washing facilities are required to be provided by the employer and accessible to all employees. If your job is outside, the employer must provide proper antiseptic hand cleaners for certain jobs. If there is a spill, follow the proper processes for cleanup, decontamination, and sterilization. 10% bleach with water provides good sterilization. Wear gloves when cleaning potentially infected areas. Do not pick up broken glass with bare hands. Use tongs or a dustpan. Dispose of regulated waste properly. OSHA defines regulated waste as any material that contains blood or OPIM in both liquid and dried states. Contaminated sharps. Pathological and microbiological wastes containing blood or OPIM. Regulated waste must be placed in containers that are closable, leak-proof, and puncture-proof, labeled or color-coded in orange or red-orange, contain the universal sign for biohazards, closed prior to removal to prevent spillage or protrusion of contents. If outside contamination of the regulated waste container occurs, it must be placed in a second container meeting the above standards. If clothing becomes contaminated with potentially infectious pathogens, remove them in a manner that avoids contact with skin and mucous membranes. If necessary, cut the shirt to safely avoid contact with the body. If there is a chance your cloths could get contaminated, always bring an extra set of clothing. Do not bring contaminated clothes home to launder. Your employer is responsible for the cleaning. Contaminated laundry must be handled as little as possible with a minimum of agitation. It must be bagged or contained where used. It must be placed and transported in appropriate biohazard containers. If laundry is wet, it must be placed and transported in containers that prevent soak-through or leakage of fluids to the exterior. If exposure does occur, immediately stop and wash your hands with soap and water. Flush mucous membranes. Report the incident to your supervisor immediately. Failure to report an incident may limit your ability to prove exposure to obtain appropriate medical treatment. Attempt to identify the source individual and collect any contaminated materials for testing purposes. Seek medical evaluation. If you have not had the HPV vaccine, it can be administered after an exposure. Employers should follow all federal and state requirements for recording and reporting occupational injuries and exposures. The employer is responsible for ensuring the confidentiality of your medical records. Your records cannot be disclosed without your written consent. The Exposure Control Plan is a guideline for employees that have had exposure to blood or OPIM and is required for each work area that has a potential exposure to blood or OPIM. Your exposure control plan must be specific to your department, reviewed yearly, accessible to all employees. Non-managerial employees shall have input on the exposure control plan. The information should be recorded in the exposed person's confidential medical record made available to qualified healthcare professionals and contain the following information: date and time of the exposure incident, location of the exposure incident, job classification of the employee exposed to BBP, identification and documentation of the source individual unless that identification is not feasible, the route and circumstances of exposure, details of the exposure, including the type and amount of fluid or material and the severity of the exposure. Identify procedural changes that would prevent reoccurrence of any conditions that increase the risk of exposure. Document what engineer controls, work practice controls, and PPE that was used. If you are working in an area where there is a reasonable likelihood of exposure, do not eat, drink, smoke, apply cosmetics or lip balm, handle contact lenses. Do not keep food or drink in refrigerators, freezers, shelves, cabinets, or on countertops where blood or potentially infectious materials are present. Sharps are defined as any object that can penetrate the skin. Pay 100% attention when handling sharps. Don't shear or break contaminated needles. Don't bend, recap, or remove contaminated needles or other contaminated sharps unless it can be demonstrated that there is no feasible alternative. If bending, recapping, or needle removal is necessary, it must be done using a mechanical device or a one-handed technique. Place contaminated reusable sharps in appropriate containers immediately. Needles should go directly from patient into sharp bins in one motion. Store or process contaminated reusable sharps so that staff members are not required to reach into the container or sink by hand. Ensure reusable sharp containers aren't opened, emptied, or cleaned manually or in any other manner that would expose staff to contaminated sharps. Accidental sharps injuries in healthcare and other occupational settings continues to be a serious problem. Therefore, the Needle Stick Safety and Prevention Act was signed into law. The law set forth to strengthen OSHA's requirements for employers to identify, evaluate, and implement safer medical devices on an annual basis, involve non-managerial healthcare works in the evaluation of such equipment, and the law requires employers to maintain a sharps injury log. The log must be recorded and maintained in a manner that protects the confidentiality of the injured employee and must contain the following: date of injury, type and brand of the device involved, where the incident occurred, how the incident occurred. Contaminated sharps are to be discarded immediately after use in sharps containers. Sharps containers need to be easily accessible to personnel, located as close to where sharps are used as feasible, maintained upright throughout use, replaced routinely and not allowed to overfill.